am glad to be here today as we start the national campaign against malaria and would like to thank the Honorable Minister and the Permanent Secretary for the warm welcome accorded to me. I want to thank the President of Uganda, plus our government, the Minister of Health, Honorable Ruth Acheng, and staff of the Ministry of Health for working day and night to deliver health services to the people of Uganda. I would like to use this occasion to laud you and all the entire frontline health workers in this country for effectively managing Uganda's response against the COVID-19 pandemic. Thank you very much. In the same vein, we gather here today on yet another important campaign to declare our intention and determination to stop malaria from killing our people. You're all aware that the COVID-19 pandemic drew attention away from other critical diseases, leading to escalation in some non-communicable diseases. As per statistics, malaria is now the leading killer in Uganda, especially in my kingdom, Busoga at 21% infection rate, Karamoja at 34%, West Nile at 22%, and northern and eastern regions of the country between 12 to 20%. Recent surveys indicate that malaria leads to most deaths in Uganda, consumes a great deal of resources, affects production, and keeps children out of school. There is also recent data indicating that malaria affects the IQ of children, leading to poor performance in schools. Honorable Minister, the statistics and data above concerned me a great deal, and together with my partners, Joshua Link and ST Biosensor, we have decided to give our contribution to help combat the current trends. I have also accepted the request by partners and the Ministry of Health for my personal involvement as a champion in the renewed efforts to fight against malaria in the Stop Malaria campaigns. To work with all stakeholders and partners to complement government and the Ministry of Health's effort to eliminate malaria from Uganda and other diseases. Our approach under your guidance and stewardship will be to launch a nationwide campaign to mobilize and sensitize Ugandans against malaria, advocate for prevention, massive testing, treatment, and training on malaria management. We are starting with the donation of 100,000 test kits to the Ministry of Health. During our campaign, we will also be calling upon the Ministry of Health and other health service providers to explore new approaches towards testing and treatment of malaria. Honorable Minister, I am aware that the current testing and treatment regime focuses on the active malaria parasites. Experts are advising the need to look at tackling the reservoir of malaria. The ministry should begin to address testing and treating the asymptomatic cases by applying treatment that kills the gemistatitis in the human body. We think this is the most effective way for eliminating malaria in Uganda. Honorable Minister and the PS, I have been informed by the sector players the importance of having adequate supply of safe blood for severely affected malaria patients, especially infants and pregnant women. I would like to inform you that the most affected regions do not have blood banks or adequate supply, and my prayer is that the ministry considers to urgently establish a blood bank in Busoga and other affected regions to be able to save lives.
Allow me to appreciate Your Majesty for the very big donation of rapid diagnostic tests for malaria that I have just received. Thank you very much. As you have heard, right now in the country, 71 districts have reported an upsurge, and the affected areas were clearly highlighted by His Majesty, including your kingdom and the region from where I come, and many others that are affected, like Acholi, West Nile, and Karamoja. If we are to transform Uganda from a peasant to a modern and prosperous country within 30 years, we need to ensure that the population is healthy and productive, and also able to create enough wealth and enhance competitiveness in our nation. As government moves forward to roll out the parish development model, we need healthy people so that we can get maximum output out of the parish development model program. This therefore requires that we focus more resources and energies to health promotion and disease prevention, and especially towards the malaria program. Your Majesty, allow me to inform you that the government of Uganda spends on average over $160 million annually on malaria. This comes from the government and from the various partners, including the private sector and cultural leaders like yourself. The expenditure that goes towards the medicines for malaria is $18.5 million annually, and towards the rapid diagnostic tests is $8 million annually. This expenditure is huge, and it impacts greatly on other programs, and yet malaria is preventable. Allow me, Your Majesty, to appreciate the Parliament of Uganda that came up with a program that is called the MAM, or the Mass Action Against Malaria, that requires individuals like yourself, myself, and everyone present here to take action against malaria by ensuring that we not only talk about it, but we also use the tools that are at our disposal to prevent malaria. And that is why it is extremely important that we come together as cultural leaders, the private sector, religious leaders, and everyone in this country to fight against malaria, that there is a malaria vaccine. The vaccine is majorly for children, and it prevents malaria up to 50%. It is not 100%, it is 50%. Uganda will be introducing this vaccine next calendar year, 2023. Even with the introduction of the vaccine, it does not mean we stop our response. All the other interventions will continue as is, because the vaccine will not end malaria in this country. I therefore want in a special way to appreciate you as a cultural leader that has taken it upon himself to stand tall and say no more malaria. This sends a very strong message to the other cultural leaders and the entire population of Uganda that joining hands together is the way to go. As I conclude, allow me to once again appreciate you for the very generous donation in collaboration with SD Biosensor and Jocelyn. It will go a long way in supporting our testing for malaria. Your Majesty, the $8 million that we use to procure test kits enables us to carry out 30 million tests annually. we are 40 million Ugandans. And if every Uganda is eligible to 3 or 4 attacks of malaria, that means we don't have adequate test kits. Therefore, the initiative by Biosensor to put a factory in Uganda is much appreciated, because we do know that whatever is produced in the country will be much cheaper, easily accessible, and in a timely manner. And so we appreciate such efforts that not only goes to support our response to malaria, but will also provide jobs and also increase revenue that is extremely necessary. Lastly, allow me to appreciate you, Your Majesty, and your entire entourage from the Busoga Kingdom. We are highly honored to host you here at the Ministry of Health, and to thank you for the efforts that you put in to enable us contain the pandemic. And once again, to request you to inform your people that COVID is on the rise, and they need to keep their masks on, get vaccinated, we have the vaccines, and also ensure that we follow the other standard